Well, doctors in Wisconsin are cutting back on how many prescriptions they write for pain medication. Now, this is one way the state is battling the opioid crisis.
But as the I-Team's Courtney Garris discovered, it could be leaving some patients facing crippling pain with one less option.
This is happening in quite a few states. Last week, patients with chronic conditions who rely on opioids begged the FDA for more options. They feel new government guidelines are actually harming them.
This is not a take an Advil and you're all better type of pain.
Kimberly Rogers has been using opioids to function for more than 15 years.
It's saving my life.
An accident that caused a spinal injury, along with some medical issues, led her down this road.
I want to be this person again. That's who I want to be.
The person who used to skydive and was an active mom.
What would happen? What would your day be like if you couldn't take these pain medications?
Oh God, forget it. Literally, I would have to go in the hospital.
A new way for doctors to treat pain. Sales of prescription opioids in the U.S. almost quadrupled between 1999 to 2014. But in 2016, the Centers for Disease Control and Prevention laid out guidelines for primary care doctors to reduce overdose and addiction risk.
The wording says these are voluntary guidelines.
But Dr. Nilesh Patel with Advanced Pain Management says Wisconsin and other states have turned those guidelines into standard of care.
We have to take care of the patients that are in front of us and give them medications. Simultaneously, deal with the opioid crisis.
In our state, there's a limit on the dosage primary care docs can prescribe. But Dr. Patel feels one size fits all isn't the best approach.
And there are many conditions that are chronic, severe, whole body conditions where we do not have solutions for these patients.
And some doctors are now turning patients away, afraid of crossing prescribing lines.
Can I find somebody who's going to be able to help me?
That happened to this patient who asked to be anonymous. She told us after 10 years of being treated, her pain doctor dropped her.
2 more.
Now in the Advanced Pain Management group, her new doc suggested a different treatment option.
Good job.
Physical therapy.
It's releasing the pain. It's kind of making it not so central.
Excellent job going higher.
Cindy Marty owns Spinal and Body Dynamics. She sees PT playing a big role in the opioid crisis.
We can change that dependency on opioids. We can change the brain's perception of pain.
Trying other alternatives to treat pain first is included in the CDC guidelines.
The research shows that upwards of 80% of opioid prescriptions could be reduced or eliminated by accessing PT first.
This patient has scaled back on her pain meds, down from 4 pills a day to 2.
You think you would have been able to do it without PT?
But non-opioid treatments don't work for everyone.
Putting a stimulator pump in, I've tried acupuncture. You name it, I've tried it.
Kimberly's doctor lowered the dose on one of her pain meds, but Kimberly says she can't drop any lower.
Scudding a whale back, I would rather die. That's just the truth.
Because why?
Because it hurts so bad without them.
And we reached out to the CDC. It told us the guideline is a set of recommendations, not a regulation, and that it's intended to give providers guidance on how to effectively and safely treat pain. Some of what's been mandated in Wisconsin, Dr. Patel feels, is a good strategy. Doctors have to check the prescription drug monitoring program to see if patients are prescription shopping. They have to screen the patient for OD and addiction risk and try non-opioid alternatives before prescribing.
Now, Courtney, you mentioned that there were some patients who simply can't try these other options, and what do?
Well, they can't either because it doesn't work for them, but then there's a cost issue. Many times insurance doesn't cover it, but it will cover an opioid prescription. The CDC told us it hopes the guidelines will lead to policy change on this. And if there is no alternative that works for you, they feel, these patients, that they're stuck with the medicine.
Yeah, and you hate to see people suffer. I mean, that's just awful.
Tough spot.
Yep. Thank you,
Courtney.
Courtney.
Thanks.